At night, when the world quiets down, our bodies begin their most important work, healing, restoring, and preparing for the day ahead. But for those over 70, the quiet hours can hold hidden risks. What seems like a simple habit, a small part of our evening routine, could silently be compromising our health night after night. It's not about fear, it's about understanding. It's about protecting the ones we love and ourselves through the simple power of knowledge. The journey through our later years should be one of peace and vitality. And it all starts with how we end our day. First, let's talk about that last meal of the day. A rich, heavy dinner, enjoyed late in the evening, feels like a comforting tradition for many. A hearty plate of pasta, a steak, or a decadent dessert can seem like the perfect way to wrap up the day. But as we age, our digestive system slows down. Processing these heavy meals so close to bedtime puts an incredible strain on our body. Instead of resting, our system is forced into overdrive. This can lead to uncomfortable acid reflux, heartburn, and indigestion that keeps us tossing and turning. The discomfort isn't just a minor annoyance. It disrupts the deep, restorative sleep our bodies desperately need to repair cells and consolidate memories. Over time, this chronic sleep disruption can contribute to more serious issues, affecting everything from our heart health to our cognitive function. Imagine your body trying to run a marathon while you're supposed to be resting. That's what a late, heavy meal does. The solution is simple and gentle. Shifting our main meal to earlier in the evening gives our body ample time to digest before we lie down. A lighter dinner, rich in vegetables and lean proteins, is far easier on the system. Instead of that heavy dessert, a soothing cup of chamomile or peppermint tea can signal to our body that it has time to wind down. This small change doesn't just prevent discomfort. It paves the way for deeper, more peaceful sleep, allowing our bodies to truly rest and rejuvenate. Now, let's consider what we drink before bed. Staying hydrated is crucial at any age, but the timing of our fluid intake becomes much more important as we get older. Drinking a large glass of water, juice, or tea right before turning in might seem like a healthy habit. However, our bladder capacity and kidney function change over time. This often leads to nocturia, the need to wake up and use the bathroom multiple times during the night. Each trip to the bathroom is more than just an interruption. It breaks our sleep cycle, making it difficult to get back to the deep stages of sleep that are so vital for our health. But the biggest risk isn't just the lost sleep. It's the journey to the bathroom in the dark. In a state of grogginess, our balance can be unsteady. The risk of a fall is dramatically increased. A fall for a senior can be a life-altering event, leading to serious injuries and a loss of independence. It's a risk we simply don't have to take. Adjusting our habits is key. We should focus on drinking plenty of fluids throughout the day, but begin to taper off in the 2 to 3 hours before bedtime. A few small sips of water, if needed, is fine, but avoid large quantities. This simple adjustment can significantly reduce the need for nighttime bathroom trips, leading to uninterrupted, safer sleep. It's a small change that offers profound protection, ensuring our nights are for resting, not for risky journeys through a dark home. The environment we sleep in also plays a huge role in the quality of our rest. Many of us love the feeling of being warm and cozy in bed, piling on thick blankets, especially in cooler months. We might even turn up the thermostat thinking it will help us relax. But a bedroom that is too warm can seriously interfere with our sleep. Our body's core temperature naturally needs to drop to initiate and maintain sleep. When our room is too hot, it fights against this natural process. This can lead to a restless night, frequent waking, and even sweating, which further disrupts our comfort and sleep. We might not even realize why we're not sleeping well, blaming it on age or other factors, when the culprit is simply the temperature of our room. Poor sleep quality, night after night, takes a toll. It can weaken our immune system, affect our mood, and impair our cognitive function the next day. The ideal sleeping environment is actually cool, dark, and quiet. The optimal temperature for sleep is generally between 60 and 67 degrees Fahrenheit, or about 15 to 19 degrees Celsius. Instead of heavy, synthetic blankets, choosing breathable materials like cotton or linen can help regulate body temperature. A slightly cooler room signals to our body that it's time to sleep, promoting the production of melatonin, the sleep hormone. It's an easy fix with a powerful impact, transforming a restless night into a deep, restorative journey. Finally, the way we position our body in bed can have a significant impact on our health, especially as we age. For many, sleeping flat on their back is the default position. It feels natural. However, for older adults, this position can sometimes cause problems. When we lie on our back, gravity can cause the base of the tongue and soft palate to collapse into the back of the throat. This can obstruct the airway, leading to snoring and, in some cases, exacerbating conditions like sleep apnea, where breathing repeatedly stops and starts. This constant struggle for air puts a tremendous strain on the cardiovascular system and prevents the brain from getting the oxygen it needs. Over time, it can increase the risk for high blood pressure and other heart-related issues. The solution is often a simple change in position. Shifting to sleep on our left side is widely recommended by health experts. This position helps keep the airways open, reducing snoring and breathing difficulties. It can also aid digestion and improve circulation. Placing a pillow between the knees can help align the hips and spine, reducing strain on the back and joints. It might take a little getting used to, but training our body to favor this position can lead to quieter, more oxygen-rich sleep. It's a gentle adjustment that supports our breathing, our heart, and our overall well-being throughout the night. These small, conscious choices, what we eat, what we drink, the temperature of our room, and how we sleep, they are not limitations. They are acts of self-care and wisdom. They are the keys to unlocking a future filled with more energy, better health, and peaceful nights. By understanding and respecting our body's needs as we age, we can protect our independence and cherish each new day. The night is not something to be feared, but a time to be embraced for its healing power. With a few simple changes, we can ensure our nights are safe, our sleep is deep, and our mornings are bright with promise. Thank you for watching. If you found this helpful, please consider sharing it with someone you care about. Take care and sleep well.